Dr. Elizabeth Roy. I'm going to show you how to self-administer an intramuscular injection. The tools that you'll need: alcohol pads, whatever solution it is that you're injecting, and a syringe with a needle. I don't often provide a separate drawing needle from the actual injection needle because I don't find it's necessary. If you're injecting something like a thick, oily substance, testosterone for example, it is. But just regular vitamin B or B complex, other water-based solutions, it's really not necessary. So here's what you do. Take your alcohol pad, and you always clean the top of the bottle. It's also wise at that point to clean whatever area it is that you're injecting. I recommend the lateral thigh. And what I mean by that is just the outside top of the thigh. So you would have your pants down, obviously. You'd wash the area with the alcohol pad. And you would make sure that you're sitting where you don't have weight on that injection leg. That'll relax the muscle and allow the solution to flow very easily into the muscle. Once you've wiped the top of your container, you want to take out your syringe with the needle attached, and you want to make sure that you turn the needle so it's tight on the syringe. Often they're not tight and you'll just end up wasting the solution. I typically provide 1 inch, ½ inch to 1 inch needles, depending upon the size of my patient. You then take your solution, you place the needle right into the middle of the rubber stopper, and you pull back on the top of on the plunger of your syringe. And if you're injecting 2.5 mLs, for instance, you pull beyond the 2.5 on your syringe, and then you'll push. You'll see some little bubbles at the top. You'll then push back to the 2.5. So you can see 2.5 milliliters of solution in there. If you have a second substance that you're adding, you do the same thing. You wipe the top. You want to hold this plunger back so that it isn't drawn into the second solution. You place the needle through the middle, and then you draw back however much additional substance it is that you need, and you make sure you don't overshoot because you won't have an opportunity to push the extra back in. So once you get the solution that you want to inject, as I said, you have already washed off the area that you're injecting. You want to then, we'll pretend that I'm sitting down here and that my pants are down. You want to then just push the needle directly into the muscle. If the muscle's relaxed, you should not experience any real discomfort. You then pull back on the plunger. It'll be difficult to pull back on the plunger because the needle is buried in the muscle. 99% of the time you're not going to see anything happen, in which case you're free to simply push in the plunger. A slow delivery is often more comfortable. If you happen to see blood come into the syringe when you pull back, simply means you're in a vessel. You want to take the needle out and place it in a different spot. You'll do this 1,000 times and most likely never get blood back into your syringe. If you start to bleed after the injection, just apply pressure with gauze and hold it there. It should clot right up and you shouldn't have a problem. You may have a little bit of bruise if you pull back. When you take the needle out, if there's some blood, just means that you've nicked a small superficial vessel. It's not a big deal, but you'll have a bruise and it might be a little bit tender. That's all there is to it. Make sure you put your solutions in the refrigerator if they're needing to be refrigerated, and always wipe the top of your bottle. It's just good, proper hygiene. There's really no need for you to wear gloves when you do this to yourself. Make sure that you've washed your hands very well before you start the procedure. You want to keep a clean procedure, so no need for it to be sterile, just very, very clean. Okay, good luck.